All right. Well, good morning, everybody. Thank you all for being here this morning. We're going to go ahead and get started as other folks join us. So I'm Jessica Wargo. I'm with the Community Foundation of the New River Valley, and we are one of the partners that is part of the NRV Livability Initiative, which hopefully you're familiar with. It's our regional plan for the future of the New River Valley. And there's several different themes that make up that plan that was created back in 2014. And so for 2021, our leadership team for livability has been doing some additional events where we take a deep dive into an aspect of the plan in more depth, talking about data that we have about an issue, and then particularly how our region is addressing that issue. So some of you may have joined us back in the spring when we had a series on housing in the New River Valley. And today we are kicking off our series on health and wellness in the New River Valley. So this starts off that series with a deep dive into the community health assessment that Carilion Clinic and several community partners carry out every 30 years. And then on October 26th, we'll reconvene and talk about a regional initiative called Healthy Roots NRV, which is meant to address some of the findings that you'll hear about today in the plan. So with that, I'd like to introduce Ashley Hash. She is the community health educator for Carilion New River Valley Medical Center. She's going to be sharing some information about the community health assessment. And just a couple of quick logistic reminders, if you would keep yourself muted during the session. And if you have questions while she's talking, go ahead and put those in the chat. We'll monitor those and then have some time for questions where you can ask those after she's done. And with that, I will turn it over to you, Ashley.
Thank you, Jess. As Jess said, my name is Ashley Hash, and I am the community health educator for Carilion in the New River Valley. And I'll be going through the community health assessment, just very top level data today. It won't take us very long to get through kind of what I have planned, and we should have plenty of time for some discussion and questions. And then I have it pulled up and I have the data pulled up so we can go in and look if there's some particular areas that anybody wants to get into a little deeper. So I'm going to go ahead and start sharing my screen, and I'm going to have to turn my video off or else things will get wonky over here. Okay. So I like to start out with showing everybody how you can access the community health assessments. So you can access them online. We have to post them all online. If you go to carillionclinic.org, community-health-assessments, then I'll pull up this page for you and you can click the New River Valley. I do like to point out that there's two different sets of links. There's these links up here that will open in more of a reader format. And then the buttons down here that have the little oval around them will open up in a PDF form. So with our community health improvement process, just to give you a little bit of background why we do a community health assessment and what do we do with it. So this is just a general community health improvement process where we conduct an assessment, then we participate in some planning, and you can have some different things that come out of that planning, an organizational implementation strategy, that's what we call it in Carilion, or a community health improvement plan, which is more on a community-wide scale. And then you go into implementation where you're implementing that plan, the different interventions or different programs that come up that make up those implementation strategies or CHIPs. And then you participate in some evaluation. So are the programs and the interventions that we planned, are they achieving the outcomes that we were expecting? So in order to have this cyclical process go smoothly, you've got to have good data. And so we start off the process with that community health assessment process. We are required as a nonprofit hospital to conduct a community health assessment every 3 years. We actually started doing health assessments before it was part of the Affordable Care Act, but we've been doing, this is our 4th iteration for New River Valley, if I am remembering correctly. So then during the community health assessment, we have to complete it every 3 years. We have to complete all of certain things within a calendar year. So we kick it off. We kicked off this assessment in October of 2020, and we had the final health assessment posted at the end of August. Right at the end of August, it got posted. And so we are still going to participate in some more strategizing as a community on how to address some of these needs, and that information is still to come. We have not planned all of that out yet, but that is where we're moving into, is that, so now we have this data from the assessment, so how are we going to move into that planning stage? The community health assessment, as part of the community health assessment, we form a community health assessment team, or a chat. In the New River Valley, we reach out to certain groups in order to help form the base of our chat, and then we invite additional stakeholders on top of that. So this year we had 3 different coalitions where we pulled from Healthy Roots New River Valley Partnership for Access to Healthcare, and Giles County Focus. So New River Valley Path and Healthy Roots are the main kind of chat for the New River Valley Health Assessment, and then Giles County Focus really helps because we have a separate health assessment that we do in Giles County. Data collection consists of the Community Health Survey, which is a, I believe, 38 question survey that we administer via paper and online, a stakeholder survey, and then we had focus groups. We were lucky this year. Carilion was not able to provide the infrastructure to conduct focus groups this year. So we were lucky in the New River Valley to have some chat members that were able to continue and figure out a way to conduct focus groups in a way that was responsible during COVID. So we still got that good focus group data, and then secondary data that we pull from various sources. And then we have to participate in a prioritization activity in order to come up with the top 10 needs of the area, and that is a IRS requirement. So for the New River Valley, this service area is based off of the patients that we see at Carilion New River Valley Medical Center. So you see that Wythe County is included where it typically would not be considered part of the New River Valley. And we do show Giles County as being included. However, the community health survey results from Giles County were not included in the New River Valley assessment. That is just going to be, those are unique to the Giles County assessment, which includes Giles and Monroe County. And Monroe County is in West Virginia. So for our respondents for the New River Valley Community Health Assessment Survey, this year looked a little quite different because it was during COVID, and typically our primary target population is going to be those who are underserved. So lower income, those utilizing different services in the area. And this year, we really got a different demographic when we're talking about when the types of survey responses that we got. The majority of the responses were from online. I believe we had about 90 paper surveys out of close to 900 surveys that we got back in total. You can see this is pretty typical that the respondent responses are mainly women. And you can see the breakdown on the service area. So you can see we only had about 3% of respondents come from Wythe County, even though that we do reach out to Wythe County and we do try and get information from Wythe County. We get very little response there just because we don't have as much of a presence. And you can see an overwhelming majority of the respondents do come from Montgomery County. household income, you can see the breakdown there. I do want to point out that this is kind of the different ranges kind of do jump as we get over, but it was a higher household income response than we typically get. However, we do typically get that kind of breakdown where we have that curve kind of going up because of the way that we have these incomes grouped. And then you can see the education level. The majority of respondents had a master's or a PhD degree. Majority of respondents spoke English. They were married, they were white, and they did have, the majority of respondents have some type of health insurance and are full-time employed. So the responses for this community health survey were a little bit different than we have had in the past year. So when you're looking at the results of the survey in particular, when going through the data, I would just keep that in mind, just because that is, it was a little bit more difficult to reach our target population with this different environment of COVID. The results of the community health assessment process.
Before she's seeing you today, but Dr. Bollinger, he has a couple residents.
Okay, thank you. What came out of this year's community health assessment, the prioritization activity, we decided to group them into kind of three main categories. They fit quite well into this. So these are the top 10 needs, not in any particular order, but grouped into the three different categories. So mental health, including access to mental and behavioral health services, access to substance use services, and mental health problems in general. Socioeconomic factors, including poverty and low household income, affordable safe housing, and transportation. And health behaviors, the culture where healthy behaviors are just not a priority, access to healthy foods, high prevalence of chronic disease in general, and lack of knowledge of community resources. So these were the 10 top needs that the community health assessment team came up with as a result of reviewing the community health assessment data. And so what I've done is I've pulled out some of those data pieces in each of these categories so that we can look a little bit more. But again, this is just a very brief overview. If you have had a chance to peek at the community health assessment report, you'll notice that it's structured a little bit differently than it has been in the past iterations. We used to use the Robert Wood Johnson Foundation framework as a way of categorizing the data as we present it in the health assessment report. And this time we chose to use the vital conditions for well-being as a way to structure the report. So it's not that we're pulling different data, it's just a different way of structuring the report. And so the vital conditions for well-being include, they're from the WIN network, which stands for Well-Being in the Nation, something, it's close to that. And I'm sorry for not having that particular, what WIN network stands for in front of me, but it's Well-Being in the Nation. And so it includes these 7 different conditions, including a thriving natural world, basic needs for health and safety, lifelong learning, meaningful work and health and wealth, humane housing, reliable transportation, and belonging and civic muscle. And so I did not pull out all of these categories for this presentation, but if you were to look through the community health assessment report, that is how we've structured that narrative this year. So looking at that first kind of grouping of top needs that we had when it goes in regards to mental health, in our service area, we have a mental health provider deficit with 68.7% of the population being underserved. So that is quite astonishing. It's not surprising for those of us who work in this field. However, to actually see that number it's quite daunting is the word that I would use. And then looking at drug overdose rates, this is VDH data here, and that is for the whole Southwest region of Virginia. And drug overdose rates increased 22% from 2019 to 2020. And the health department actually put out a special kind of report talking about mental health and COVID. And this is where that data point comes from, because the COVID and the results of COVID has really had a high impact on mental health, and we have the data to back up that as well. Mental and behavioral health was indicated as a top need by both community stakeholders and by community health survey respondents. So it was tied for first place according to community stakeholders, and it was number 3 when it came to community health survey respondents. So mental health is ranked up there as one of the things that the community is telling us that needs to be addressed. Moving on to socioeconomic factors. Oh, my font got messed up. Sorry, I'll read that out. So our top needs are poverty and low average household income, affordable, safe housing, and then transportation. And we have 16.6% of the population living below the federal poverty level, and that varies from locality to locality. And we can kind of go into a deeper dive of those different localities as well. We have almost 1 out of every 4 households being cost burdened, which means that more than 30% of their household income has to go towards household expenses. And that would be things like rent and utilities. So it doesn't include things like food and stuff like that, but anything that it costs to run the home. And that is exceeding 30% of their household income. And then we have 5.6% of households in the area without a motor vehicle. And so they lack that source of reliable transportation. And that also varies between counties. And I believe it was close to 9% in Radford City of folks that do not own a vehicle. So it's a problem across the service area, but the burden of it will vary based off locality, based off income, and based off of whether you're located near a town center. And then looking at health behaviors, top needs were a culture where healthy behaviors are not a priority, access to healthy foods, high prevalence of chronic disease, lack of knowledge of community resources. And so almost 36% of our census tracts contains food deserts within the New River Valley. And we have chronic disease and cancer rates that are higher than the state averages, including for asthma, chronic lower respiratory disease, coronary heart disease, stroke, obesity, colorectal cancer, and lung cancer. And colorectal cancer in particular, all localities were higher than the state average. We can look at it in particular because I don't want to say anything incorrect, but that was just notable to me that basically all of our localities have higher rates of colorectal cancer than the state average. And then we have 23.8% of adults reporting no leisure time physical activity. And that is from the community health survey results. So that would be that kind of smaller group of people that we sampled in addition. So that's all I had pulled out for us to talk today, because there's so much data that comes in that community health assessment. And so I really wanted to spend a lot of time on questions because I do have those sources kind of pulled up for me. So let me, I will have Jess send this information out, and I'm going to stop sharing so we can talk a little bit more in depth, and we can see that, some of that data, and I can pull it up and start sharing again as well. But do we have any questions right off the bat? Just feel free to, or do we have any in the chat?
Let's see. Hold on, I'm pulling one up from the chat from Naomi. Talks about if last year was on housing needs as a priority, was there any follow-up to the progress made?
That's a great question. And so we have had a response to the last community health assessment. So it was 3 years ago, 2018. And that a lot of that was healthy roots. And that's actually, we lay a lot of that out in the community health assessment report. But we discovered when we came together as a group of stakeholders after the last community health assessment that a lot of these social determinant needs were very broad sector. They were cross-cutting across different industries. And it wasn't something that those folks that were coming to the table that were mainly healthcare providers, or the folks that are coming together for the community health assessment, we were not, we didn't have the capacity in our own organizations and with our own kind of group of people to affect the kind of changes that we needed to see when it came to housing and transportation and poverty and all of those those big social determinant issues. So in response to that, we decided to host a community event, which we called Healthy Roots, was the kickoff event. And then I believe Jess is planning on talking more about that in kind of how we're building the capacity to respond to those issues. And so while we don't have any kind of direct initiatives when it comes to housing that came out of the community health assessment and the community health assessment team and Carilion in particular, we are trying to build that capacity. And I do know that they did just complete the housing study as well. So that is something else that we'll be able to look at as we are bringing together folks kind of as we build this capacity to address those things. But that's a great question.
Hey, Ashley, so there's also some additional questions coming up. I'm just going to go in order. Question about the federal poverty levels by locality, and if you can share that data.
Let me see if that is, so we pulled it and it will just tell us. So if it's below the federal poverty line, so I can pull up that information and send it out to you. I don't have, let me see if we have it in a chart already. Okay, I do have, let me share, I have a map here. Okay, so this is looking at the population below 200% poverty level by census tract. And so you can see that it varies from this dark blue color, which is over 50%, to the green that is under 26.1%. So you can see there's a pocket in Montgomery County and then Pulaski County. You see Wythe County with a large pocket of those in the 38 to 50% below the 200% federal poverty level. And more details about that can be in the are in the report. This is the report actually up, and this is kind of the section where we've pulled out that data based off the vital conditions for well-being. But then there's additional information as you scroll down in the appendices of the report.
Thanks, Ashley. So continuing with our chat questions, Michelle is asking, wondering where we're getting the higher rates of colorectal cancer and whether they're due to lack of screening access, lack of healthy nutrition, or the result of other comorbidities.
So here are those cancer rates. And so you see it's every county except for Montgomery. And we don't necessarily know, so I don't have the answer as to why that colorectal cancer rates are higher. That is where we can do some more digging. So the community health assessment kind of brings up this, we do like a really broad catch of a lot of different data points. And then after we come up with these priorities, then we can kind of dig in and figure out the why and figure out where we can affect change and develop those interventions around those things or to affect those things. So while we didn't kind of dig into it yet, if that's something that we want to look into, we could pull it together stakeholders. But because that didn't show up as one of the priorities necessarily, I mean, healthy behaviors did, we probably won't dig into that unless there's something there's an intervention that folks really want to kind of come behind, if that makes sense. But that's where those numbers are at. And I did also, looking at those lung cancer rates, you can see how much higher in Giles County and Pulaski County those lung cancer rates are compared to the state and compared to other localities. I think that number was interesting as well. But one thing that I really like to stress about the community health assessment in general is that this is just our starting point. And then we dig into the different pieces as we are developing those that strategic plan and those implementation strategies and deciding which pieces that we want to target as a community.
So a couple additional questions in the chat regarding recruitment of healthcare professionals. So Susanna is particularly asking about mental health professionals and whether there are plans to attract and recruit them, particularly those that work with young people. And Morris followed up with other specialties as well. And so plans to recruit those kinds of specialties given how hard it is to access them in the region.
Yeah, so that was something that, so focus group data, I didn't pull out the focus group data specifically, but specialty services was I think it was 100% of the focus groups came up with specialty services is hard to access in the area. And then mental health services was right behind that. And I know as our health system, we are keenly aware of the need. And so we do have actual positions out that we are recruiting for. It's just a difficult time where mental health providers are in shortage across the state, and kind of recruiting to this area can be a challenge from what I understand. So we are actively recruiting. Specifically, I just asked this question about a developmental psychiatrist for pediatric developmental behavior provider. And we do have at least one position open that we're recruiting for when it comes to that. And so it is something that is that we are aware of, that we are working towards. It just is it's a difficult thing right now. We've been struggling to attract and retain providers, and that it's really the health system in general right now is kind of short-staffed. But you know, even outside of COVID, it's just it was an issue before COVID, and then COVID kind of just elevated the need for those behavioral health providers in the area. And so we are aware of it, and I don't work in that area, but I have been assured that they're aware and they are doing kind of best practice in order to get the folks in that we can.
Okay, and then Lynn asked an additional question around classroom, whether there are classroom resources to address these issues. And Lynn, if you'd like to come off mute and maybe give a little bit more context in terms of age group of classroom or what you're looking for.
Oh, sure. I work in a Montessori class in Floyd, and the kids are 6 to 12. They're elementary age, and I wanted to expand our parent group and support, and I wondered if there were things that we could do for parents and also to address some of those issues in the classroom, like the healthy behavior, the food, and just addressing mental health concerns in general.
Yeah, I think that there are resources out there in order to, if you want to do something with your own business organization, right? So I thinking on at your organization, if you want to take this data from the community health assessment and decide to do practices differently in your own organization, I think that that is what a lot of different, I say organizations to include businesses as well as service providers, right? That's what we kind of do is we come together, we do this health assessment, and then we've been coming up with our individual implementation strategies or what we're going to do. So there are plenty of resources out there for that. I see Jenny Martin on there. She's great for healthy food resources for kids. And then when talking about mental health care, you know, I think in particular, when we're thinking about how to address these things, there's kind of two different parts. And that's what I was trying to get at, is there some stuff that we can do on our own in our own organization, in our own sphere, and then we can come together with each other and figure out an overall community implementation plan, right? What are we going to do to come together to address this? And so, Lynn, if you would like to reach out to me, I'd be happy to get you connected with particular people in order to get, you know, just classroom resources if you want to do something on your own with your own organization.
Oh, thank you. Thank you. I appreciate that.
Okay, are there any additional questions? I think we've gone through the ones in the chat. And Ashley, maybe as folks are adding some more, can you just speak to what might be different in this year's assessment than maybe what we saw 3 years ago? Did you see anything that you feel has changed or priorities that have shifted over the last 3 years?
I really see a lot of the same things coming up. I do, when it comes to, let's get back to the top needs here. These top needs look very familiar to me. I can't remember exactly kind of what, you know, how they match up to our 2018 assessment, but the theme, the feel of it is very similar, where with the socioeconomic factors like poverty, affordable housing, transportation, those have been at the top since I've been on board, as well as mental health services. And then when it comes to health behaviors, I do see a little bit of a shift as a not focusing so much on specific diseases, but more kind of thinking broader about what health is and what we can do to address it, right? So if you look at these health behaviors, it's, you know, healthy behavior is not a priority, kind of overall in general, the culture, access to healthy foods is a little bit specific, but then you think about high prevalence of chronic disease, again, very broad, and then lack of knowledge of community resources, again, very broad. And when you think about lack of knowledge of community resources, that's it, that kind of spans all of these different areas, right? We really could have plugged it into mental health or socioeconomic factors. So basically, I see it very, very similar as to what we saw 3 years ago. And they're still coming up to the top, and there's still those broad sector issues, right? There's still those things that, you know, we're going to have to come together as a community in order to solve it, because it's not just one particular area. It's like, it's not, oh, we fixed this and we fixed, you know, the community health assessment, right? it's nuanced. There's different levels to it, and we really have to dig in. And when we figure out something to address, there's going to be different modes in which we can address it, right? And so we have this kind of wraparound, this multi-pronged, I think is what I'm trying to say. This multi-pronged approach that's all addressing one thing, right? Transportation, you can have a multi-pronged approach because you can increase organizations' ability to get out, right? Like the health department goes out with their mobile bus, their mobile unit, and can go out and get to places now. But also we can talk about increasing bus routes, right? Expanding bus routes, increasing hours of bus routes, those types of things. So I really see them coming to the top again. And I feel that they will continue to come to the top until there is some systematic change, which can only come from coming together as a community.
Helpful. Are there other questions or comments from the participants? And I know we've got some folks on the call who are also part of the community health assessment team, so feel free to chime in as well. Any other comments or questions for Ashley? Okay.
Well, in that case, I did want to show, this is something that came up in our discussion, and I did want to show this map while if we have a moment here. So this is looking at broadband services, because this is something that's kind of come up when we've been talking about, especially during COVID, when we switched to a lot of internet-based appointments, and just realizing that with social distancing, physical distancing, the difficulties that not having internet provided to different households. So if you look at this map here, this is showing the unserved and the underserved areas. And you can see that looking at our area, so this is Radford. It's kind of hard to see. Our Giles is up in here. And then Downwithville is down here. But you can see that our service area, according to this map, we're mainly have service. And so I did dig into that a little bit further. And so I pulled out only wired broadband coverage. So now this is looking at that same area, but the colors are where there's wired service. And so any place where you don't see the darker green or the blue or the purple, so like here with the light green, all of this light green here, all of that would be only from wireless providers. So that kind of dug into the data a little bit more. I think that it's interesting because I think I haven't really looked at grants when it comes to internet service, but I would imagine that our area, because we are showing here that we don't have any unserved or underserved areas, it might be difficult for us. But then having this data from Virginia Tech to show kind of this is where they're only served by wireless options. And then we can maybe look at the reliability of wireless options and those types of things. But I did think that was interesting because that is something that has been coming up in some of our discussions lately.
So Morris added another question to the chat asking about recognizing that diet, exercise, and behavior are crucial to health, but what about environmental factors such as access to clean water, et cetera? So did the report look into any of those factors?
So we do not, haven't in the past looked at environmental health very specifically. And so I'm trying to see, we did pull out, nope. I'm trying to get there. Yeah. So I know I looked at clean water, thriving natural world. Is this it? So we do have some data on that. It must have been another assessment I was working on where I pulled out some of that because we were looking at air quality and water quality. And so since I don't have it pulled out, it probably was because it's pretty standard. So a lot of the data that I pulled out in this written form, it was very much where do we vary from across the state? How are we different? And so when I was looking at, and this was a different service area, but we're pretty close. What I was looking at is the air quality is pretty good compared to the rest of the world. I know that there, just from being a New River Valley resident, I know that there have been concerns with open air burning and things like that. And that is something that we haven't typically pulled into our community health assessment. I do think with this restructure and starting to focus on these vital conditions for well-being and kind of broadening our perspective of health, there is opportunities in coming assessments. And certainly if that is something that the community wants to work on addressing, we can look at pulling more data for that, but we don't have it specifically. I don't have it pulled out in the report, but it could be in the appendices. I'll look into that for you, Morris, and send it to you. And if not, I can look at some sources and get that information for you if you would like it.
And just pointing folks to the chat, we've had some folks add some resources as well. John Dance added some resources around substance abuse and mental health initiatives. Mm-hmm. So go ahead and take a look at that as a resource for based on the questions we asked earlier in terms of mental health need. Are there additional questions for Ashley or comments from the discussion? Great. Well, seeing none, thank you so much, Ashley, for presenting the findings of the health assessment. Just so everyone knows, if you participated today, you'll get an email by the end of this week that will include a link to the health assessment as well as a recording of today as well. So you can take a closer look at the report and really dig into the data, and then of course ask additional questions from that. There was a lot of questions in the chat around sort of what do we do now that we have this information, we wish it were an easy answer, but it is not an easy answer. Nonetheless, there is an active initiative that that Ashley referred to, Healthy Roots NRV, which is really looking at how we bring the region together and take some existing collaborative work that's happening and really pull it underneath the umbrella of health and well-being in the region. So the second part of this series is digging into Healthy Roots NRV, what it is, what it wants to be, and how to get involved with it. So again, in the email that you'll get, you'll be able to also register to hear about Healthy Roots at our October 26th session. And if you can't make that, do know that recordings of each of these sessions are going to be posted to the Livability website. So you'll have a chance to see those as well. And you'll be able to get emails with links to those recordings as well. Any final questions or comments from our participants?
I would like to add something, Jess. I really, I always like to do this when I present community health assessment data. If there is data that is missing, or if there's a priority that you have that did not show up, the best way that we can change that is for you to get involved. So either, being in this is great just to be aware, so you can bring that back to your organizations, but also, come join the community health assessment team, when we do it, join the discussions about how do we come together and solve some of these issues, because really the priorities that rise to the top are the things that we know that the folks in the room have been looking for, right? And so there is this, whenever we do assessment, there is going to be this introduced bias because kind of our scope, what we're looking for in our scope. And we try to be broad as we can. And we try to keep expanding that. But if there's something missing, if there's something that you think, needs to be a priority that didn't show up, please come. We want you to be involved. We want to know about the things that we need to come together around for the community. So if you are interested, I can keep you in the loop of when we're coming together to come up with a community health improvement plan. Yeah, just get involved. We'd love to have you.
Thanks so much, Ashley, for that. I'll echo that getting involved is the best way to be able to look at the data and the questions in much more detail and to add to it. And then I'll also add that many of the folks that are on this call and have attended these are also part of organizations that do other fantastic assessments to give kind of a broad sense of what's happening in our community. And in fact, one of the things that we're wrestling with in Healthy Roots is how do we make sure that we're not over-surveying the community and really understanding the role of these different kinds of assessments. So I'll just plug in particular, New River Community Action does a fantastic needs assessment for the low-income community and provide some information on the range of services that they provide, which is a really helpful document. And then we referenced earlier the regional and local housing study that that NRV Regional Commission did, which provides some great information on housing in the New River Valley and some suggestions on how the region and localities can address it, among many other excellent reports that I'm sure I am forgetting right now. But those are some great resources to take a deeper dive into the information and a nice complement to the community health assessment. So lots of great information for our region. So with that, thank you all for joining us this morning. Thanks again, Ashley, for presenting the information. And we hope to see everyone next month to talk a little bit more about how we as a community can address the findings that we heard about today. Everyone have a wonderful day. Thank you so much. Bye-bye.